Senator Thune, if you see the Baucus bill as a bill that is, or it's not a bill yet, it's likely to reduce costs.
I think that's the big question about all of these various pieces of legislation that we've had in front of us is what do they do to reduce costs? Even the Congressional Budget Office has said repeatedly that in this bill in particular, the Baucus bill, the most recent version of a health care reform proposal here, is a $1.7 trillion cost over 10 years when fully implemented. And that if you actually look at what it does for most people in this country, they're going to see their health care costs not go down but go up. The premiums are actually going to increase. And the reason for that is that many of the taxes imposed in the bill to help pay for the cost of the $1.7 trillion expansion are going to get passed on. And so the people who get hurt by this are hardworking Americans who are expecting that if Congress is actually reforming health care, that would mean that health care costs, that the cost that people pay for premiums for their health care coverage would actually go down. The Congressional Budget Office, under questions that were raised yesterday by some of our colleagues, responded that dollar for dollar, that those taxes that would be imposed to pay for this would actually be passed on, and that you would see higher health care costs. And so there hasn't been anything in this entire debate yet, or any of the bills that have been put before various committees or that eventually we assume will be considered on the floor here in the Senate and the House of Representatives, that have actually impacted costs in a way that they go down, that it reduces the overall cost for people in this country. And furthermore, and I've talked about this, and the senator from Tennessee, we had this discussion on the floor yesterday, is that many Americans, those that I heard from in my state of South Dakota during the month of August and in any conversation that I have out there, are very concerned. And they're concerned really about two issues. One is control, one is cost. Who's going to control their health care? Is the federal government going to do it? Is it a bureaucrat in Washington, D.C.? Are we ceding more and more, in this case 1/6 of our economy, more and more control to people in Washington, D.C.? And the Baucus bill, in as much as it doesn't, at least at this moment, contain the, quote, government plan, still assumes a high level of government involvement, government intervention. Government would determine which health care plans would have to approve, which ones would meet the standards that the government set. And so you've got a high level of government intervention with this plan, as you have had with all the other plans, but perhaps even more importantly, and this is the issue that I think most Americans are really homing in on, and that is the cost. What is the cost to me as a taxpayer? In this case, $1.7 trillion over a 10-year period when fully implemented, and does it reduce my cost of health care? So they're going to look at it two different ways. One is, what am I going to have to pay in the form of higher taxes to finance this? And secondly, how is it going to impact the cost of health care for me in terms of the premiums that I pay? And I think it's fair to say that based on, and this is not what we're saying, it's what the Congressional Budget Office has determined, that actually the cost of health care for a lot of Americans under this proposal, and the Baucus proposal, is going to go up.
Medicare cuts. I mean, those are scary words to most Americans, and some people say, well, you Republicans are just trying to scare the seniors of America when you say the word Medicare cuts. But isn't it a fact that the Baucus plan would cut Medicare by about $500 billion and use it for a different program instead of shoring up the Medicare program?
We know for a fact that the Medicare trustees have said that the Medicare program is destined to be bankrupt in the year 2017. So Medicare is already on an unsustainable path. It needs to be shored up, and what we're talking about doing is getting savings, if you want to call them that, or cuts, I would say, out of Medicare to create a whole new entitlement program here in Washington, instead of fixing and making more sustainable a Medicare program that, as I said, is destined for bankruptcy by the year 2017. And I think most seniors and most providers around the country are going to be very concerned about the idea of having their cuts to the Medicare program, $500 billion, as the senator from Tennessee has mentioned, go toward paying for this new entitlement program, which, as I said earlier, over a 10-year period is going to cost $1.7 trillion. So you've got, I think, you not only are going to have, as you've mentioned, a lot of providers who are very concerned about cuts I think you're going to have an awful lot of seniors who are concerned about how their Medicare benefits are going to be impacted by this proposal. And I would add what you've already talked about, and I know the senator from Tennessee, his governor has called some of these Medicaid expansions the mother of all unfunded mandates. My governor in my state of South Dakota, I've had numerous conversations with him about this. It would cost our state about $45 million a year new revenues that they would have to raise just to meet the matching requirements under this expansion of Medicaid. And in my state of South Dakota, that's real money. I know that doesn't sound like a lot out here in Washington, D.C., but that really adds up. And so he's very concerned, as are all governors, about the impacts not just on federal budgets, but on state budgets. And of course, as the senator from Tennessee and the senator from Kansas have pointed out, Medicare, and I might add, I love the quote that the CEO at Mayo, which the senator from Tennessee has mentioned, if a public plan looks like Medicare, I think the country would go broke almost overnight, because Medicare is already proposed to go broke by 2015 to 2017. And I think that's the problem that we run into when we try and build upon a foundation that is already crumbling. And the Medicare program is destined to go bankrupt. And we're talking about adding a whole new entitlement, and instead of trying to figure out how to plow some savings back in to Medicare and make it sustainable, we're actually adding to and building upon a foundation that is already crumbling.